Well, welcome everyone to the Best Practices in Physician Relations Programs webinar presented by Stratasan. If you all have any trouble hearing me at any point, just send us a chat or ask a question, and we will hopefully rectify any audio issues. Hopefully you can see my screen. It should say, welcome to the Best Practices in Physician Relations webinar. And I'm Leanne Lambden, Senior Vice President of Strategy, Healthcare Strategy at Stratasan. And I'll be interviewing Mitzi Kent, Senior Director, Physician Relations and Industry at LifePoint Health, and Dustie Maguire, Regional Director of Physician Relations and Industry, both at LifePoint Health. So this is our agenda for the webinar today. We'll introduce ourselves, and then we'll discuss the organization of physician relations programs, goals and responsibilities of programs, hiring and leadership, some tips on relationship building, intelligence and information that can be used, and compliance. We will leave time for question and answer at the end, but at any time, please enter your questions into the question or the chat box. Either one. So I'll tell you a little bit about Stratasan. Stratasan provides intelligence to hospitals, healthcare systems, marketers, and physician relations representatives, equipping them to make better decisions and maximize system growth. We partner with over 600 hospitals, helping them achieve efficiency and effectiveness in their strategic planning initiatives. We provide an analytics platform. We also have projects called Spark that we can provide for customers. And then we have Physician Pathway, which you'll hear more about later. So Mitzi, tell us a little bit about LifePoint.
Thank you, Leanne. I'd love to. LifePoint Health was founded in 1999, and it's more than a $5 billion in revenue company. We certainly are financially strong, and what we do is serve those small communities out in the marketplace. We're about 70 plus hospitals in 22 states, and we have approximately about 40,000 employees with more than over 7,000 physician relationships. We're leading in healthcare providers in our community, and we work very closely with those in the community to keep them healthier. We're fully accredited by the Joint Commission, and we're committed to keeping healthcare local. We have lots of proven partnership strategies. For one example, with our relationship with Duke in the North Carolina area, and our mission is making communities healthier.
That's great. So Mitzi and Dustie, please tell our audience about yourselves and your experience. Mitzi.
Sure. I have been in healthcare for over 19 years. I have a diverse experience in strategic development, service line planning with a lot of large healthcare systems. At LifePoint Health, I'm responsible for providing overall direction and development, as well as the evaluation for the national physician relations teams for over our 70 hospitals in our 22 states. Our goal is establishing and achieving targeted sales objectives for service lines and markets and individual facilities. I'm also responsible for overseeing the strategy and planning, as well as the decision support teams for the organization. Most recently, I've been national speaker to other healthcare systems and physician relations programs and how to start, and developing and specializing in positioning healthcare services in hospitals through referral development, network expansion, and acquisition in highly competitive markets. Currently, I work very closely with hospital management teams and group leadership to develop annual organizational and individual hospital strategic plans that help achieve outstanding business growth and loyalty. Before coming to LifePoint about 2 years ago, I had a position at Gentiva Home Health and Hospice as their VP of Sales leading the Southeast Division. And prior to that, I worked 8 years with HCA, starting their VP of Sales program with the Physician Liaison program for the TriStar Division. I have a respiratory and infusion background with also experience leading sales teams with American Home Patient and PharmaThera. And I'm also a certified professional selling skills trainer, and I've conducted national sales training for many organizations across the country. I'm a native of Philadelphia, Pennsylvania, and I have a Bachelor's of Science in Nursing from the University of South Carolina, where I specialized in pediatric oncology.
Thanks, Mitzi. Now, Dusty, tell us about yourself.
Thanks, Leanne. I'm a seasoned sales professional with more than 14 years healthcare sales experience that spans the launching of pharmaceuticals, hospital service lines, home health business development, and overall strategic planning to expand growth opportunities and organizational return on investments. As a leader for LifePoint Health, I also provide some direction in development and evaluation for the National Physician Relations team for our organization. Before joining the regional directorship role here at LifePoint Health with Mitzi Kent in 2015, I served as a physician relations industry rep for a hospital in our organization in Kentucky for almost 9 years. I was able to successfully work with my physician leaders and hospital administrators there to drive volume and increase our provider satisfaction. Prior to LifePoint Health and our facility, I worked with LHC Group, a patient care representative for them, which is a home health company out of Louisiana, responsible for generating their strategic growth in my market. Finally, my professional sales experience started with Aventis Pharmaceuticals as a leader for their metabolism unit. I had an Eastern Kentucky division stretching all the way into Tennessee and West Virginia and launching several pharmaceutical products for them. And I held a Bachelor of Science in Biology from the University of Kentucky.
Wow, we definitely have two experts here today. And I, Leanne Lambden, I'm going to be asking the questions today. I have 25 years in healthcare planning experience in large health systems, community hospitals, and then small critical access hospitals. So I think you'll be very pleased with our experts today. Thank you both for being with us. So in answering these questions, I hope you both will pull from your many years of physician relations experience, not only your experience at LifePoint, but you do have years of experience in other organizations. But first, a few questions about your specific department at LifePoint Health to put our discussion in perspective. So what is the name of your department?
Our department is Physician Relations and Industry, and that title, that acronym has existed with LifePoint for quite some time, but with Mitzi's direction, she specifically gave us industry so we could expand on local employers, not just physicians inside of our facilities and in our markets. We have local, we have inside the company, PRI is known, but that's an internal language. The physician relations team has internal customers, which are the CEO and leadership and department directors, and they also have external customers, which would be our referral sources, our physicians and or industry leaders. And their goal is to drive growth for our facilities.
Great. So where does the physician relations role fit organizationally? Talk about a corporate role versus a local hospital physician relations role. Absolutely,
Leanne. So physician relations is part of a bigger group called Operations Strategy and Integration Team that's under the great leadership of Ms. Melissa Wade, Senior Vice President of Operations Strategy and Integration. Physician relations at the Health Support Center here is responsible for supporting, coaching, and training those physician relations staff in those local markets. We here at the Support Center serve as a consultant for those physician relations at the hospital. And the local physician relations staff grow volume at the hospital by calling on physicians and by understanding what those needs are and understanding what barriers they might have to growth, whether it's improving quality, customer service, or even access to the hospital. Physician relations representatives at our hospitals have a solid line to our CEOs, but they have a dotted line here to the support center. And that is so that we can focus and help them train on service line development.
So if you think about the hospital role, do you think the physician's relations staff should report to the CEO at the hospital or elsewhere in the organization?
That's a good question, Leanne. It really depends on the size of the organization. In our smaller hospitals, reporting to the CEO can be very beneficial for the PRI in the eyes and the ears of the CEO, as being the eyes and the ears of the CEO in the physician environment. Therefore, they can give direct communication and feedback to them. However, in large organizations, it's beneficial to report to VP of Business Development and or Sales, for example, because the rep will have time to devote to the physician relations function.
Okay. So now we're going to move on to talking about more generally, not just your organization, but some goals of a physician relations organization. Some goals and responsibility. So what would be some good goals of a physician relations program?
Well, Leanne, that's a great question. And there are many organizations that try to be very specific about their goals. But first and foremost, I think it's important that a physician engagement, physician relations program is there to grow volume in alignment with the strategic hospital plan. The purpose is really to engage and connect with those physicians and other physicians to support those key hospital services. Physician relations should be out there, understanding, identifying those needs of those physicians, resolving issues, and maybe removing those barriers to growth. There are times when physicians do not have a voice, and it's our physician relations teams that gives them that voice and connects them to that leadership team. It's important also that we ask great questions as a physician relations team to provide that feedback to that hospital staff. And many times, like Dustie said, they are the eyes and the ears of the CEO in that physician community, and helping them to determine opportunities for growth and improvement and ways that we can partner with our physicians is extremely important.
So you mentioned barriers. What are some barriers that a physician rep might identify? That's what I went off script there.
So a lot of the barriers can be many times to access. Quality. Maybe they're not sure how to send a patient through to our hospital system, or maybe they have felt that it takes too long to get a hospital into either one of our practices or into one of the hospitals for an imaging services, let's say. So many of those times we identify that as a physician relations team out in the field to say, here are the barriers to growth, and as a team, bring that back to the hospital and sit down together and look at ways of resolving those barriers so that we can continue to grow that partnership with our physicians.
So it really helps identify some of those opportunities for process improvement within the hospital.
Absolutely, it does.
As the PRIs are out in the field. So what are the major responsibilities of the department?
We like to outline the major responsibilities being to drive growth. That's probably the biggest one you'll hear us comment on. But to do that, like Mitzi mentioned, you have to remove or decrease the barriers that your referral sources have to your facility. We want to also make sure that we're compliant with issue resolution and timely and providing good quality customer service. And we also have onboarding of physicians as a responsibility of PRI, and building and partnering with the physicians and specialists in order to drive that growth that's needed.
You mentioned onboarding. What's some examples of onboarding? What do you do with physicians to onboard them?
Sure, that's a good question too. So like any other new business, when a physician starts in an area, it's important that they get out to meet their referral sources, so their colleagues, their other medical staff members, to meet the community, to make them aware of the services that they're now providing, in addition to the business side of onboarding, which there's a lot of making sure the practice is set up appropriately, making sure they're set up for success, making sure they have the relationships with hospital directors, those things that are important for a new provider to have when they start a practice in a community.
All right. So what's the difference organizationally between a physician recruiter and a physician relations rep?
That's a great question, Leanne, and sometimes it can be confusing to those that are either starting a program in their hospital. Your physician recruiters are out there looking for or identifying physicians when they see a medical need in their community to bring a physician into that community. What your physician relations team does works very closely with those recruiters, but what they're doing is maintaining that relationship. Once that physician comes on board and they have been onboarded within the facility, that physician relations representative makes sure that they maintain that relationship and ongoing gives that physician a voice to your hospital for any barriers that they might have.
All right. So now we're going to move on to hiring and leadership. So first of all, what type of person, background, experience, characteristics do you like to hire for physician liaisons or physician relations reps?
Ideally, the physician relations reps will have a college degree with at least 2 years of sales experience, and we prefer them to have it in a medical supplies or pharmaceuticals or some sort of a healthcare industry. But I will say that we have many representatives here that are new to healthcare, but really have that drive. And again, we're looking at those behavioral competencies of being someone that's organized, self-directed, assertive, outgoing, and have that hunter mentality.
I love that hunter mentality, but can you all describe what that is?
Sure. The hunter mentality, I know most of you on the call have heard it, but just to describe it, we eat what we kill. So if you have that mentality, you're very competitive and you like to thrive in a competitive environment. It's sometimes described as an innate quality or a trait that an individual has. And the traits that they also have are determination, resourcefulness, and persistence. I want to think that most of us have that in us if we're in sales, or it's an ideal quality to have. I'd love to share just a little story from my experience of having a hunter mentality. The scenario for myself was a CT surgeon in my market wasn't thriving, wasn't receiving the referrals that he had hoped to get at our facility. And we tried every approach we knew, and we decided to take some risks. How do we get the referrals that we need for his survival? Otherwise, he was going to pack up and leave to another facility that would support his service line. Thinking outside the box, he and I approached podiatry for some vascular cases and uncovered there were tons of referrals that were being out-migrated, but they were going through the PCPs first, so the primary care physicians like to be the owners of those referrals. With the empowerment of the CT surgeon and the relationship with the podiatrist we made in the region, not just in our county, he was able to book out cases for nearly 2 months just by getting creative. We decided we were going to find vascular cases, and we did. So not giving up, having that persistence and being creative, knowing that if you don't think of a way to do it, that service line may not survive.
Yeah, that's some pretty outside the box thinking, trying to get business for a cardiothoracic surgeon and going to the podiatrist to get that practice started. I mean, that's some really outside the box. Usually you'd think about just hounding cardiologists and PCPs for that kind of business. So let's talk about measurements. What measurements should be used to measure the success for a physician relations rep? How do they know if they're successful?
Well, Leanne, that's a very important piece because most sales professionals want to know that they're being successful and really actually do want to be measured. So ideally, you would want to measure on volume-based measurements for many mature programs. And that's what we're currently structuring our physician relations program here. It's a very data-driven approach to improve ROI. However, there's more than just volume measures. We have to focus on, are we improving the quality and the satisfaction, provider satisfaction to our hospitals? That's a great measurement to know, are we giving those physicians a voice? Are we giving, as you said, we talked a little bit about industry is in our title, we call on employers. Are we giving those employees or those consumers the satisfaction with our hospitals? So I do think it's very important that those physician relations representatives know exactly what they're going to be measured on and that they have control over those measurements so that they are not demotivated and that they can continue to grow and be successful and thrive.
So I was reading in preparation for this webinar the 2014 Society for Healthcare Strategy and Market Development Physician Relations Program in Hospitals survey. I think they conduct it every year or so. And 46% of the respondents indicated that 10% or less of the employee's base salary was incentive pay. So that was a little less than half. 33% responded that 11 to 20% of base pay was incentive compensation, and then 63% of that incentive pay was based on financial targets and revenue growth. So there seem to be a lot of differences in how physician relations are compensated. But in your opinion, what would be the ideal compensation package? What would it look like for physician reps?
Leanne, it really depends. Most of it really depends on the market and the combination of how you would want to do a base salary plus an annual bonus. But the pay, it really does need to be related to key service line growth that was set to the budget and for the organization. And I think that that's what's important for the organization to determine what is it that they want to grow? What is it that they're trying? What are their goals in regards to quality and provider satisfaction? And then how do we measure on that? And then how are we going to incentivize our physician relations programs on that? So I've seen it in many different ways in many organizations that I've been a part of. But there is a volume-based component to it. And I think it's just important that they do have some part of their base salary at risk for that.
Yeah, so it really, I keep hearing you say it goes back to sort of what's the strategy for that product line? What's the strategy for the hospital? Everything goes back to setting the strategy. So what else comes out of the strategy or budget? So how have budgets and staff, have they increased or decreased in the last few years for physician relations departments?
For us, staff have increased. It's our goal to see that there's a PRI or business development leader in each facility that takes on this role for us so we can drive growth in all of our markets. Salaries have remained competitive, and unfortunately, departmental budgets are the same, if not less, due to hospital budget cuts.
And would that be things like lunches or, I don't know, things you do with doctors? Is that the kind of budget cuts? Because if the salaries are competitive, it sounds like maybe some of those more traditional selling methods might be getting cut.
Right. Well, we just use wisdom on that, just getting creative on how we entertain or achieve those same goals. We can host meetings where we have multiple medical staff members versus maybe the waste that was in the markets before of expenditures. So certainly making our PRI in the hospitals, while these budget cuts are out there, making them more aware of how they can be creative to get the same message or get the time with their clients in order to talk about growth or remove obstacles.
Yeah, great. So now we're going to talk about some relationship building techniques for physician relations. So should hospital PRIs or physician relations reps coordinate their visits around marketing pushes? For example, if you're marketing cardiology, should the physician relations department also have a strategy around cardiology?
Yes, that in the ideal world, that would be perfect, and definitely what we encourage them to do, because you have that synergy when you work together. If marketing is specializing in collaterals, as we call them, or graphic pieces for the PRI, we talk about sometimes having local markets do a sales blitz around a new service line with the appropriate material made by the marketing department. We love to coordinate physician-to-physician encounters, primary care to cardiologists during a cardiology campaign, so you can have those MD to MD visits, as we call it, or provider to provider visits. These can be so much more powerful than just a liaison going out asking for the business or for the growth and trying to remove obstacles. When you have, as we like to call it, a white coat talking to another white coat, there's just a trust. There's things that'll be exchanged that maybe can't be exchanged.
Well, they're in the club.
Right. So we're always grateful when people coordinate those blitzes and the opportunities to take advantage of that. Each hospital does have a strategic plan, as we've talked about. And from that, the marketing sales plan is developed. So we encourage very early on, even prior to the year, that sales and marketing get together and look at their strategic plan and coordinate for the year the ideas, the tactics, the strategy around those service lines, what they're going to do to work together in order to drive growth around that. So they're specifically sitting in the same room talking about that. And physician relations will provide a support center that makes that suggestions and best practices can be used with local hospitals.
Well, that's the benefit of being in the system. You can take some best practices from one and spread it out to a lot of the other hospitals. So give me some examples of topics that the physician relations rep should cover with physicians when they talk to them.
Well, certainly, I think it's important for us to always cover either new specialties or any service line updates. But one thing that we really encourage our sales team to do is not necessarily show up and throw up with lots of information, but to really be engaging with that referral source and uncover needs. And so we spend a lot of time with our team teaching on sales techniques regarding probing and uncovering the need behind the need of either the physician or the referral source so that we can find out what's important to them. A lot of times it's about what are those needs of the physician and how can we and what services do we have that will partner with that physician so that they'll choose us for their services or have their patients choose us for their services.
So is there a certain type of physician that the liaisons focus on? Is it out-migrating physicians, new physicians, physicians not familiar at all with our hospitals, or physicians with changes in referral patterns?
You know, Leanne, it really depends. Physician relations reps, they don't primarily just call on physicians just to grow volume. Like I said earlier, it's important for us to remove those barriers, but also to improve quality and service to our patients and physicians. And that goal is to identify those issues regarding access and any other barriers that we might find. We have found that when we can remove those barriers to growth and really partner with our physicians, we have a lot more success. So we do track, volume monthly, and so as we notice change within those volumes, we call on those physicians to identify what's going on, what can we do to better service your patients, and a lot of times that's when we identify issues. And we bring those issues back to our leadership teams. And by resolving those issues, those physicians and our referral sources see us partnering with them and begin to then make us the choice for patient care.
Well, also, if you're tracking those internal volumes and you're tracking referral patterns, it also lets you know who to thank. It's not just, what went wrong, but thank you for your business. So should physician relations reps make appointments with physicians or primarily cold call on physicians?
Well, this will vary based on market and by PRI or your rep. Many that are very seasoned in their markets have open invitations or have a system that works well for them, being included in office staff meetings or have access to the back door or can come and share updates or maybe even have standing appointments at a certain time every week. Once they've earned that, certainly isn't advised for the new ones. We encourage them to make appointments so it's meaningful dialogue that's exchanged. You're not wasting your afternoon in a lobby waiting among lots of other reps, but also differentiating yourself as an extension of hospital administration and as a part of the medical staff liaison, that you are not among the other reps that are trying to sell them something that day. So this will depend on the relationship of the rep and the market many times.
I love all the answers that are, well, it depends, and I love how you're telling it depends on what. So next we're going to talk about intelligence, the information that you all use. So what information do you use to determine which service lines you're going to focus on for your plan for your physician reps?
Well, Leanne, here at LifePoint Health, we are very fortunate to have an amazing strategic resource group full of talented analysts and managers that help us analyze the demographics of a service area and be able to strategically look at a product line and look at hospital market share by product line. These types of analysts help us determine where we're going to spend our time. And we know from a sales rep's perspective, time is the one thing that we can control. So if we know strategically where we need to focus, and the strategic resource group helps us determine that, we know that we're going to be a lot more effective in the field. So by talking with the physicians, we can help drill down to that next level and how we can remove those barriers to increase those volumes in those areas.
Great. So in the physician relations program, what types of information do you use in your PRI program?
Well, currently, right now, we do use a CRM program called MarketWare to track our issues, our timeliness of those issues. We enter every call that we make to a physician, to an industry, to any referral source. We do that to be able to provide information back to our leadership teams, to stay compliant within our organization. But it's a great way for us to look, and we track that data, and we have dashboards that show our activity so that our activity can lead to results. We also use internal volume data, and again, that goes back to what I was talking about with our strategic resource group. We have cost accounting data from our a program here where the managers and analysts have helped us track those procedures and that data from the previous month. And we're able to get that, and we meet as a team at the hospital level, what we call growth teams, to analyze that data, to look at where we see are some trends. And again, that helps the PRI physician relations team focus on where to go make their calls and determine what obstacles are out there. And again, physician referral tracking, we do use the Stratasan physician pathway. We find that physician referral data helps with the physician relations to be able to have those conversations. It helps us, again, really hone down into information about which physicians are referring to what other physicians, and help us make sure that we are letting them know about the services and the programs that our hospital can provide. And again, that goal is using that referral data to focus on time, determine routes, and really organize how we target our physician visits.
So since Physician Pathway is a Stratasan product, I'm going to ask you how you could use Physician Pathway in your physician relations programs, or any physician relations program could use Physician Pathway, and what benefits it would be to a physician relations department.
Sure, Leanne. I've had the privilege of working on Stratasan's Physician Pathway and looking into the product over the last couple of months. It's very easy to use. And as Mitzi and I talk about, a sales team without data is kind of a blind leading the blind. So like she mentioned, we rely heavily on our strategic resource group to give us direction. And so this is just a tool in our bag of tools that helps our PRI to look at and determine where the focus needs to be for multiple reasons, for routing. But just to go into the application will allow a PRI to see how cooperative and how a physician network is working and how well physicians are collaborating with one another. So you can specifically see what physicians are utilizing what specialist in your market. And that gives PRI direction to follow up on several levels. There might be quality or service concerns between physicians that you need to identify, address, and remove, so those physicians will have a better working relationship. The app also shows if there's an obstacle preventing someone from utilizing the specialist altogether. So maybe it's they've lacked the trust initially, so you need to take that provider around to introduce them and to talk about some of the quality and their outcomes. And perhaps the physicians won't tell you about that, but the data does. So you can sit down, it's your truth source. You can look at that and have some direction on how you're going to spend your time in your market. And the tool also identifies several areas for us to focus on, like I said. And Mitzi mentioned your time is very valuable to you. So you can look at the areas in your primary and secondary service markets and where you need to spend time to introduce service lines or to promote those opportunities for growth within physicians in that market.
So the Physician Pathway tool uses real Medicare claims data in an effort to keep the platform compliant with regulations as well as affordable to customers. Does this create benefits or limitations using the tool?
We think it creates a benefit because Medicare data is real information without modeling. Most markets want to know what their Medicare volume, referral volume looks like, and can derive how the overall market is utilizing their specialties. From that, Medicare referrals usually indicate what other business is doing as well. And this is a perfect way for us to look at how we work with those physicians to either provide more opportunity to collaborate or thank those that already are. sending service or
Yeah.
sending referrals to our service lines.
So this slide does talk about the physician pathway approach, straightforward and simple, like Dustie was saying, data transparency being real Medicare data, cost effective and risk averse because it complies with a lot of the regulations, which we're going to talk about next. So we've talked about the many ways to use data in physician relations program, and in 2015 there were at least 3 lawsuits settled by the federal government against hospitals that were compensating physicians based on referrals, which violates the Stark Law and the Federal False Claims Act. So how should hospitals not use physician referral information?
Well, Leanne, we take that very seriously here at LifePoint Health and have done an enormous amount of training, not only with our physician relations staff, but with the organization as a whole. And we've developed great tools and great training that has been done by our legal team, also our compliance team, and continues to be done by Dustie and myself. So certain ways we shouldn't use this referral data is definitely to have conversations with physicians that might be perceived as coercive, threatening, intimidating, or even pressuring physicians to refer to patients. We know we cannot do that. We also know that this referral data cannot be used to justify whether we hire or fire a physician. And we also know that this information is really for us to guide us and to help us identify where those barriers to growth and for access and quality. We know that reducing or increasing compensation to physician based on this data, we cannot do that. And we also know that it's important for our hospitals and our systems to be trained regularly on this. So not only do we do an annual training, but we also have in our system that is required by all growth team participants, as well as our physician relations, online training, as well as in-person and webinar training.
Good. The next question I was going to ask is, what kind of training do you have? So thank you for covering that. So now we're going to turn the webinar over to our attendees. If you have any questions, please either put them in the chat box, which I like because you can see the chat box, or you can ask a question on the actual site, on the GoToWebinar. I'm not seeing any questions from the attendees. Very disappointing. Sean has one left over from earlier when we were testing the system. That one doesn't count, Sean. All right, so I think we have a question here. Well, now I'm trying to open the question and see. Oh. And we have a hand raised, so I'm going to unmute Margaret to see if you can ask your question. Margaret, do you have a question?
Hi, yes. I'm in a small hospital, and what do you suggest, and I'm a business development manager with also kind of a physician liaison role, and how do you navigate when there's maybe some polarizing political personalities and you're trying to, you know, grow your service lines, but you're afraid to maybe cross certain lines because of maybe personality or political conflicts among the physicians?
Margaret, that's a great question. I'm surprised at all that there's any kind of political maneuvering between physicians. So I'm going to leave that one for Mitzi.
All right, great. Well, thanks for asking that question. That can be very difficult, and we experience that too. Some of our hospitals are in very small communities, and it may be a one group, two group town, and when you start working with one, the other seems to be getting offended with that too. We've always taken the approach of understanding what the mission and the goals are of that particular physicians group. So we actually do meet with all of our physicians to understand what their growth plan is and how our hospital can kind of better partner with that. And then we very much are very transparent and share our strategic plan with those physicians too. And if they are aligned, then we talk about how we can partner together. And sometimes with some physician groups, it's just not aligned, that they have a different goal in mind. And we clearly understand that and make it very clear that we're going to probably work with one group versus the other due to the alignment and the needs of making sure that we're keeping our patients closer to home and keeping them in the community. So a lot of times, again, it just comes from meeting with them, understanding what their goals are and their growth plan for their particular practice, and then sharing your hospital strategic plan and how that would work together.
Does that help you, Margaret?
Yeah, I think that's what we're trying to do is just be as transparent as possible and keep the patient focused and understand where we're not going to be able to push forward any longer with a certain group and then sort of redirect. So it sounds a lot like what you're saying that you're also doing. So it's
Absolutely.
really good to hear.
Yes, absolutely. And sometimes those are difficult decisions, but again, you said it beautifully by saying keeping it the patient, the center focused. And when you always do that, you can't really make a wrong decision.
Yeah,
Agreed.
keep the patient focused. I think you're right. You can't go wrong. We've got 2 more questions. One is, what time should be allocated to recruiting and liaison work if an individual is responsible for multiple roles? I'm sure that's a big issue for a lot of people. You're probably responsible for marketing and recruiting and physician liaison. So how do you manage time with multiple responsibilities?
Well, that is a great question and a very real question that we get from our PRI that wear multiple hats daily, if not more frequently than that. You have to certainly work with your CEO or your leader to define what it is that your goals are for the PRI and for that recruitment role. We here like to support our local facilities, and those things change. So if you have a season where recruitment is very heavy for your facility, it may be that you're spending more budgeted time on the recruitment opportunities in order to sustain a service line or to grow a service line that's critical. And maybe your physician PRI visits and those responsibilities are put to the side. And may flip-flop. As soon as you gain that recruit, you go right back to those heavy visits and onboarding that physician. So that's a fine balance. I would recommend working with your leadership team to make it clear what their expectations are of you and the division of those roles and responsibilities. So that way you're pleasing those that are expecting you to do both jobs. Does that help?
And I think another part of an answer to that would be always go back to your strategic plan and whatever you're measuring as an organization. It'll really help focus your attention instead of chasing squirrels, as we call it. Focus on those product lines that you said in your strategic plan, be that through marketing or through your physician relations or physician recruitment. We have another question. What examples or resources do you go to for training purposes? These are written in questions.
So I think it's very important that leaders not only provide training to their sales staff, but I think if this question is for leaders, what do you do to help kind of expand your training? I think it's very important that you take on training personally and look for conferences that will help better train you. I know that there are several conferences out there that are devoted just to physician liaisons and also physician liaison leaders and groups. Several, and I know that they are expensive and can be expensive, but they really do bring some value. And if you can show your leadership team about what you've learned and how you can bring those pieces back to your market and show them here are some of the key things to do or what you can do to expand and what you've learned from other organizations, it really does have a return on investment. A couple of ones that I think are very useful is SHISMED is a great conference to go to. There is also the Physician Strategist Conference that's being held in May in Chicago, which is also leaders from all over the country of physician liaison programs, as well as physician liaisons themselves that attend this. There's a marketing track, there's a sales track, so really great programs that are out there for you as a leader to get training. And then it's important for you to bring that back to your team and share what you've learned and give them that kind of training.
All right, we have another question. Our hospital is in a small market where visiting regular physicians occur. How often do you schedule a visit to those providers without overloading them? So you're in a small market, you've got a lot of opportunity to visit physicians. How do you schedule to visit those providers without overloading them?
That's a fantastic question too, because you can easily, as a PRI or sales lead, wear out your welcome if you're visiting them every other day and you're a non-paying distraction to the provider and their staff. So I'm going to send that back to the rep to ask questions, know your client, know your market, determine what the best flow is for you and route accordingly. If you have 20 docs and all that in your full time doing that, you should certainly try to make it a biweekly or monthly visit with certain ones. Maybe expanding your reach would be an opportunity, not just calling on those 20 that are in your back door, so to speak, but trying to find opportunities in your secondary market where you can expand your reach to other clinics or other hospitals. But I wouldn't recommend more than a biweekly. If you have a small medical staff or an opportunity, they're going to get tired of seeing you and may start avoiding you unless you prove that there's lots of value and meaningful dialogue.
So make sure you have something to say.
Absolutely. Being prepared for your call would be one, as long as you discuss that with them. I plan to visit you every other week, and each time I'm